As we grapple with a national pandemic and strive to address systemic racism and inequality within our community, we face yet another critical challenge: the rising incidence of gun violence on our streets. This is not just a Madison problem. Gun violence is on the rise in cities and towns nationwide. And gun violence in Madison is not confined to or rooted in any one neighborhood or community. It affects the entire city, fueled by reckless and dangerous acts of a few individuals, intent on settling scores and willing to endanger their neighbors or innocent bystanders in the process. Our response must also be citywide. Traditional policing is an important and necessary strategy, and MPD is working hard to hold accountable those responsible for the recent gun homicides so we can avoid more senseless deaths. I talk regularly with Chief Wall to keep apprised of the situation and MPD's response. I also agree with Common Council President Sherry Carter that more needs to be done on the prevention side. There are programs working in cities across the country to interrupt gun violence, and we need to find the model that will work in Madison. One current city effort uses a peer support model, intervening in situations where there is a risk of violent activity and extending support to people affected by violence. Another prevention effort funded by the city works to help those formerly incarcerated to build better lives and reduce recidivism. And while we must invest in programs specifically designed to reduce violence in our community, we can't forget that the best prevention is equitable access to opportunity. Madison is still one of the most challenging places in the country to raise a Black child. That must change. We must provide equitable access to housing, healthcare, education, employment, childcare, entrepreneurism. Every opportunity in our community must be accessible for all of our young people. Every level of government and all of our institutions, public and private, must focus on this work and be part of the solution.